Hi everyone, greeting from Vietnam. My name is Thanh Tung and I'm Executive Director of Lighthouse Social Enterprise and Young Key Population Lead Organization in Vietnam, working towards a future of better health, equal rights, and sustainable development of the young key population and LGBTIQ community. And you can see how of my teams and our volunteers here in our event, community event. Today, I'm good like to share with you my leader and experiences on working with the young generation and using ICT to provide the health information and also health solution for the community. And Lighthouse is a young key population lead organization, and we aim to empower the community with strong capacity and voices and advocate for the community rights and help them to improve the access and utilization of sexual health and general health services and information to ensure that no one left behind. And we are focusing on promote sexual health and mental health among the LGBTIQ community and young population. We also conducting the community-based participatory action research and study for advocacy, and we increase the advocacy for the rights of LGBTIQ and young population, and empower and building capacity of the community and strengthen the community movement in Vietnam. Here you can see a number of the pictures and photos from our activity with young people. We're working with students in university, working with young population in the field, also LGBTIQ community in different community events like Pride event and also Women's Day event. And I myself is not belong to the generation Z, but it's just very pleased working with the young people, and we learn so much from the young people as well. So my this slide talk about what we know about the Gen Z. We know that for some international definition, that Gen Z is the people who was born after the 1997, and they totally dynamics and different characteristic with other generation. So here I just trying to search information about the Gen Z on the internet, and we found some very interesting words about this translation. As we know, that's the young peoples and the Gen Z. They are true digital natives from the earliest youth. They have been exposed to the internet, social network, and about the mobile systems and the big data and technologies. And here you can see in this chat and this word clown, you also can see social media is and very common and very popular at the moment, and it starts from the Gen Z. And we also access to the very diverse information, and it is social justice warrior. They are social justice warriors. They also have been mentioned about the antisocial. Sometimes there are some like very negative social norms for the generation Z's, like antisocial or technical addicted, or they also be called by I generation, as mentioned about internet. And in this generation, they also really emphasize about individuals' expression, and also about the connectivities between the people and between the humans. This is very interesting when we're working with this generation. It's very important to understand the generation about the characteristic and what they want and what is their cultures Um, and it's really helpful for our programs and our activities to reach and to working with them. So for this generations, and because we're talking about big data, we're talking about social medias and multiple channels that we can reach the generation, we have to think out of the box. How can we have creative activities? How can we have the creative way to reach to them and provide them services and provide them information? We can use social media, but we can think about some other solution, creative solution, to connect community with the services. And I'd like how we working with very specific young and young key population, that the population who are affected with HIV and people with young people living with HIV as well. And there are some very interesting data that we collect from a different market research and also a different science research on HIV and sexual health in general. Um, there are some very meaningful numbers. The first is a high, HIV prevalence among the young people. In Vietnam, we have the LGBTIQ community is one of young key population, and the HIV prevalence among this population is more than 12%. This is extremely high, and it's predicted to increase rapidly in the coming years if we don't have any very creative and effective solution. And about the STI, the sexual transmitted infections prevalence among this population also very high. The newest data is showing that there are more than 40% of them have at least one STI, and only near 50% reached to HIV testing in the last 3 months, and is even lower. Only 24% of them reached to STI testing in last 3 months. But very interesting and very potential way to reach out to the young LGBTIQ community and also young people in general. Um, in one market research on HIV services among the LGBTIQ community, there are nearly 90% of them has smartphone, and nearly 98% of them has the social one at least one social media account. So that is very interesting data to see, like, how can we use the social media and technology to solve the problems and to improve the health of the young generation and young LGBTIQ people. And at Lighthouse, we also use ICT in our work to educate the community, to promote the message, the positive message, to connect them to the services, and also to expertise healthcare worker and make sure that they can access to the information and services equally to other young people. Um, and then we also keep them in our service circle and help them to connect to broader community. And now we're using different kinds of the social media to achieve our goals. We have the Facebook page, we have the website, and also an app on smartphone. So communication, we're trying to promote the information about the health, sexuality, HIV prevention, HIV treatment and support services, and also improve the public knowledge about the LGBTIQ community and sensitize them with the accurate information. We also provide the online counseling, and now we don't have much times and very big venue to provide the in-person counseling, but online counseling help us to reach faster to our community. And if they have any question, we can provide the information and counseling to them. Um, we also combine with offline counseling because we see that we can not only using social media to address the whole issues, but we should very flexible combination between online and offline solution. So we still have the on-site counseling and service delivery after the online counseling. And the last, we try also provide the services through the online. And now we only not we not only provide counseling online, but also provide the self-testing, self-test kit, where people can access the HIV testing easier. And we also think about how can we provide the other services online, where community do not need to go to the health facility directly, but they still can access the services from their home or from their comfort zone or comfort place. You can see here is one of our channel. It's called G-Town because we really focus on the gay community. So G-Town stand for Gay Town. So we can people can access to the Facebook page and website and application. And here is also another social media campaign. It's called My Health, My Choice, because we're trying to promote the the needs of community to proactive protect themselves and access to the services, especially with the HIV services. It is combination of one social media campaign to promote the holistic health for young people and connect young people to the friendly and quality health services in our network. We're trying to not only focus on HIV, but also provide them a multiple and very diverse information on, like sexual health information, on also the social health and also mental health issue as well. It's also be expressed by very attractive pictures and very young faces on our pictures, and with very accurate information. Now I want to introduce you with one application that we developed in last year, and now is promoted and also used by the LGBTIQ community in Vietnam. It's called Hunt, and our slogan is "Be a Safe Hunter." As you know, that young people, they like the feeling to be a hunter on social media, where they can find the partners, the friends, and they also can find the sex partner as well. And especially for the gay community, they go online where they not suffer with stigma and discrimination to hunt some six-pack guy, the handsome guy and cute guys, and hunt like to be a friend of the community and help them to be a safe hunter. In this application, we provide accurate and direct information and knowledge to LGBTIQ community. And we have the sexual health and HIV/AIDS. We have the mental health. We have the harm reduction information for the people who use drugs, and community news, where people can connect to the community, to broader community, and be updated about the community news and activities. Um, and the next function, we provide them the list of friendly healthcare facility where near them that they can go online and find the information, the very comprehensive information, not only the name, not only the address, and about the contact information, but also the services that they provide, what is the feedback from the other clients who experience with service in there. And also they also can leave the comments, they also can find the navigation from where they are at to the healthcare facilities. And you can see in the screen the service map with very diverse, comprehensive, and friendly services. We just define the information about the friendliness of the healthcare facilities by the community itself. People can leave comment, people can provide the feedback, but we also collect the quotes and information from other community members to know about the friendliness of the healthcare facility and introduce it to the community. In this app, we also provide the function where the young user, they can make an appointment with the healthcare facilities. Like I want to go there for the HIV treatment, because in Vietnam, HIV is still people are still very stigmatized with people living with HIV or the key population that people affected by HIV. So people can make an appointment in on the weekends, or maybe after the daytime. They can come in the nighttime and they can make an appointment with the doctors and healthcare facilities. They also can chat online with the counselor, and sometimes it's a doctor, sometimes it is expertise and trained counselor who very friendly and understand community and have good knowledge and expertise on health to help the community. We also think that social health is really important. There are a lot of the LGBTIQ people who face with mental health issues and suffer with suicide and also the stress or anxiety. So we're trying to help them to connect with broader community. They can engage in some community event. They also can join community platform and talks and share with other community member where they feel they belong to. And this in this app, we provide those kinds of platform where community can connect to the other. The other service, we also provide many products where community very easy to access and can book online, and then we can deliver the products to them, like very diverse condom and lubricants. We have the pre-exposure with HIV medication. We also have the HIV treatment medication and HIV cell testing and HIV rapid tests, where people can access and we can deliver to their home, and they can do it at home. So it's very convenient to the community. And now we are also thinking about provide a mobile doctor and online doctor where they can provide they can deliver the prescription to people who are not going to see them in person, but they can chat and they can provide the test result online, and then doctor can know and provide the counseling for them through these apps, or maybe through Zoom or any other application that people feel comfortable with. And here is a service provision from online to offline models. It's only within 17 hours from approaching to the treatment. From start from the 5 p.m., we have the counselor and peer educator approach the community online, and then they meet offline after 1 hour or 1.5 hours. And within that meeting, they also provide the test, the lay testing, the mobile testing at the meeting venue, like maybe coffee shop, or maybe in the client home, or maybe in somewhere that people feel comfortable and privacy. And after and the test result is reactive with HIV. So after 6 hours in 12 a.m., they sleeping, and in the next day morning, they will start to do confirmatory testing. And just after 2 hours, after when they get the confirmatory testing result, they can get treatment, ARV treatment. So it's quite very quick and very convenient, service provision models applying for the community to easier access to HIV services. And that is my last line. Now the technologies, the internet, social media is play very important roles for the young generation, and we are very creative. I know that the community, the generation Z is very creative. People is very dynamic, and also it's very that people have a lot of ideas. So I think we can work together. We can think together and act together to change for a better world for the young generation. So thank you very much, and I hope that you will have a very success webinar. Thank you.